Hello, and welcome back to Venus Rising. I am your host, Callie Fell. Today on the show, you get to hear from Pamela Garfield-Jaeger, a licensed clinical social worker with over 20 years of experience. I actually had the pleasure of meeting Pamela at the premiere of our new documentary film titled The Detransition Diaries: Saving Our Sisters. And now I have the pleasure of speaking with her and sitting down with her today. A little bit about Pamela. She has served primarily teens and families, working as a licensed clinical social worker in a variety of settings, including community-based organizations and agencies, residential programs for foster youth, and in schools and in mental health clinics across California. She has been a clinical supervisor for up-and-coming therapists for about 10 years. And in 2017, Pamela had to leave her profession due to a severe disability. And when she returned, so much in the mental health profession had changed, particularly when it comes to the treatment of gender dysphoric patients. In the teen clinic that she was at in California in 2021, 3 out of 10 kids identified as trans. Since she had been in the field with vulnerable youth for over 20 years, this was a very drastic change, and we'll talk more about that today. Pamela has spoken to many therapists who agree that instant affirmation of young people with complex mental health conditions is inappropriate. However, those therapists are being heavily silenced. Pam has been emboldened to speak out on these issues and build her own program, also something we'll chat about today. So, Pamela, thank you so much for joining me. I appreciate you coming on.
Thank you for having me. This is great. I appreciate it.
It's great to have professionals like yourself who have so much experience be willing to talk about these issues. And I kind of want to dive right in. You have a unique experience in that you were working as a social worker, had to take a hiatus due to disability, and then you came back to a completely different landscape. So let's talk about that experience and the changes that you saw.
Yeah, it was crazy. So I've been a social worker. I actually got my degree at NYU back in 1997. That's when I graduated 99, started 97. So I've been around and I've worked in all kinds of settings in New York City and in California. I've worked with foster kids and I've worked in a lot of programs. I landed a lot more with people with mental illness, so people with schizophrenia and bipolar and severe depression. And I worked in group homes, so a lot of attachment trauma type issues and family therapy, schools. That's the other area where I was really working. And I was a clinical supervisor for about 10 years. So I've been around.
And you have
And
so much experience with youth, and the
yes,
youth that are being told that they're born in the wrong body specifically.
well, that honestly, I didn't have that much experience with that before because that wasn't so common in the
Okay.
past, quite frankly. So I was very familiar with working with youth who had trauma, people in foster care, people who had child abuse histories, people with just other mental health issues in general. And so I work with a lot of kids with behavioral issues and families. And then I've also just worked in general at schools. So throughout the peninsula, which is in California, in the Bay Area, in Silicon Valley area, I was working as a supervisor, overseeing other therapists, working in the schools, working with kids throughout the whole area, like spanning about like 10 schools. I was doing that. And there were actually very little trans youth that time. I stopped working with my disability the end of 2016 or 2017 actually. And then I popped back in just a little bit, tried to get back to work in 2018. I worked for I'm not sure, about 6 months then, and then I had to drop out again. But even in 2018, that's when I think things were starting to grow with this, but it still wasn't that bad the way it is now. It wasn't, I mean, it wasn't as pervasive. There just weren't as many kids. And so I was working at all these schools and people weren't keeping secrets from families. People were working collaboratively with parents. That was what I was teaching the interns to do. It was just a whole different world. And then I came back just as a per diem, which means basically I was just filling in shifts. I was working 2 days a week, mostly at a IOP PHP program, which is it's individualized outpatient program, partial hospitalization program. And that's basically a group therapy program for people who have usually a mental health issue that had landed them in the hospital, and they're transitioning back
Mm.
outside from the hospital. And it's sort of like a stepping stone from coming out from some kind of serious mental health issue. So I was doing that that was in 2021. And
Mhm.
that's where I saw the shock, because I was
Okay.
actually working there. I had the contrast right there. I was working with adults and kids, and the teens at that program. But I was working more with the teens because they needed more help with the teens, and
Yeah.
because I happened to have more experience and be good with the teens, so they kept putting me there.
So what were
So
you seeing like when you went back? What was so drastically different?
yeah, so oh my gosh, like you said in the intro, 3 out of 10 kids were usually non-binary, trans identified in some shape or form. At this time in 2021, at this program, they were all girls. I think it's changing. I think more boys are getting involved in in this. Um, so there, I might, maybe if I were back now, that I'd be seeing some boys. I'm not sure, but
Mhm.
at the time it was all girls. So basically, it was half the girls actually. So 3 out of 10 out of the total kids, half the girls
Mm.
were uh, non-binary. And I think the most shocking part about it was not just that the girls were saying this, doing this, but it was my colleagues and how they were reacting to it, which was really strange to me. That they just were completely ignoring all of the very obvious issues that were there.
Mhm.
I mean, there were kids that were, it was seriously obvious that they were using it for some other purpose. They were having other issues, like they were
Other
struggling
mental
with
health
something.
issues, social issues.
Yeah, they were struggling with something. Usually,
Mhm.
I mean, these are kids that were having mental health problems. They had just come out of the hospital, usually for depression or a suicide attempt or something like that, and they were feeling really out of control in their lives.
Mhm.
And then they were using these new identities to kind of gain control of their life, to in a way to avoid things. Um, they even some of the kids were talking about how they were conflicted about it, and the adults weren't kind of gravitating towards that to explore it, be like, well,
Mm.
why are you conflicted about that, or what,
Mhm.
what's happening. There was this one girl in particular that I still remember, who she was very insightful. She was only 12, I believe, and she had a lot of self-harm. She was cutting. She said she had sexual trauma. I wasn't working with her one-on-one to know her entire background, but she had trauma. um, she said she really appreciated her parents and said her parents were really loving. But at in the same breath, she would say they were transphobic because they weren't using her pronouns properly.
Mm.
She said her mom would try, but then behind her back would be using her dead name. And
Uh,
then her dad wasn't doing it, and she said her dad was transphobic and a bigot. But then she would say in the same moment that her dad was a good dad. Those were her words. She would say, he's a good dad.
mhm.
And so clearly there was a disconnect there, right? And I felt like she was really grasping for someone to explore with her. What is this? What's happening? And,
Mm.
she couldn't make sense of it. And the therapists weren't doing that with her. I did that with her in the groups I was working with, but I was only working with her in a group setting. So I wasn't doing one-on-one therapy with her. So I couldn't do, I think, the work that was necessary.
Why do you think so? You're not the first person that I've spoken with, both on Venus Rising and not, that talk about how medical professionals, mental health professionals aren't doing the work of kind of helping teens explore what's going on. Rather, they're pushing them towards accepting medical treatment for, and I put that in quotes for those listening, for this dysphoria that they have. Why do you think that?
Well, I mean, now I have a lot of insights on it, but I have to tell you, at the time, I was fresh to all this and I was dumbfounded. I was like, what
Mm.
the heck is going on? I mean, this is so strange. What I was observing there at the time, I'll speak from my naive place and then I'll talk more about, since I've learned a little more about the climate. I just watched them really tiptoe around everything and be really nervous about being looked at as politically incorrect. There was a lot of that.
Mhm.
We were in the meetings. We had meetings every day where we would go over the new intakes and talk about the cases, what's happening new with the kids. And they, even when the kids weren't present, they had to use the proper pronoun. In fact, that was one of the first things. what's their pronoun on the chart. And I was like, what, that's the most important thing we're talking about here.
Not that they've been,
Yeah,
a victim of sexual trauma or, wow.
exactly. So, and I was very new and I was part-time, just per diem.
Mhm.
I had been out on disability, so I felt like I had to get my feet wet again. So I didn't feel comfortable just jumping in and being like, what's going on here?
Right.
But I did say things a little bit here and there, and people would either ignore me or just kind of did not know what to say. So I think it looked like to me, and I don't even want to knock these individuals I was working with because I actually really like them.
Right.
And they, aside from what I'm describing right now, in general, a lot of them were really skilled and did some good therapy. They weren't all bad.
So
So
I think generally, right, speaking, people go into medicine, therapy, social work, the gamut, because they want to help people. Like that's the goal. And so when we talk about medical professionals who are failing the system, like I also don't want to be so hard. We just need to look at this more clearly. But yeah, we have to recognize that something's going wrong, but genuinely, I think they want to help people, right?
oh
So
yeah,
yeah.
they definitely wanted to help. But I think there's this desperate need for people, and I think it just brings, my profession brings about this temperament of people who want to be seen as, by others and I think by themselves, as good people, as someone that's not rude or disrespectful or offensive.
Mhm.
And I think that's been weaponized against my profession, against people in my field so hard that that's where we've landed.
Yeah.
So I was watching that happen in real time. It was really strange. And honestly, I was kind of participating in it too, but weirdly, like I was like, well, what? And they, I remember being really awkward about it
Mhm.
or avoiding the pronoun altogether and really trying to just de-emphasize it, right? That's what I think, that's how I was handling it at the time.
Mm.
Um, but yeah, I also, now I'm really much more aware of how much censorship has been happening. Those that have tried to speak out really have gotten canceled. They've either been ostracized by their colleagues or lost their job altogether. When I was working there, I read that book by Abigail Schreier, Irreversible Damages, and she wrote there about people through those years that I was on disability, how many people of my colleagues or people in the psychology world had been canceled, both in the academia and in the clinical realm, how they just lost their jobs, how they're completely shunned.
Mhm.
And that was all shocking to me. I didn't know just how pervasive the cancel culture was. Anybody who just said something to the effect of, we just need to figure out what's happening with this individual out, I was like, oh, so that's why we've landed here. People have been weeded, they're being weeded out. They have been weeded out for quite a while, and I wasn't aware of that.
Mhm.
So that was happening. I think that was a big part of it. And then now I'm in California. We're both in California. There's a lot of laws that are stopping people from being able to do their jobs. At the time, even to 2021, those laws weren't in effect, but we were headed there. But now people are so scared to do anything because they'll lose their license. And those with ethics, they're avoiding working with kids. Those that are aware of what's going on, that have the same insight I do, they're just say that I won't work with kids. And so I just think there's so many angles here. It's definitely coming from top down.
It's heartbreaking too, because also in California, we're having a hard time, having, I called the primary care and they're busy or I can't get a doctor. And the same is true for mental health professionals. And so it's really heartbreaking to hear so many leaving the profession because of this, but can you talk a little bit more about the laws and the changes specifically? So people know, I feel like I tell people what's happening here, or I tell them about how in schools, because you've worked in the school setting, how parents are being completely removed from the conversation and things are hidden from them and people don't believe me sometimes. So can you speak a little bit more to that?
Yeah, so again, these are the shocking things, because when I was working in the schools just 4 or 5 years ago, this wasn't happening. Maybe it was, but not to the degree it is now. But yeah, what's happening in the schools is the counselors are being trained to basically trans the kids behind the parents' backs. I mean, they're not just doing it because they think it's clinically right or something like that. They're actually being trained top down to do this. And if they don't, they get in trouble. That's what's to me so insane. It's not just that, oh, well, they have these rogue therapists or these virtue signaling therapists, or whatever you want to call it, that think this is the right thing and they're doing it. I mean, maybe that's how it was in some points, but now it's coming from top down. The administrations, the CDC, is it the CDC, one of the big bodies? I think they just put out a whole guidelines for schools to trans kids, um, and to use all the pronouns. And yeah, they're keeping secrets from parents, and that's the other big shocking piece, because my entire training, and I come from a pretty, I'd say, liberal or left-leaning background. I went to NYU. I actually did a full year family therapy training in Berkeley, California, where we were learning how to connect families. I mean, so even like what was previously liberal minded is being completely eradicated about splitting up families. So that, yeah, so they're splitting up families, and it's wild to me, I guess.
Yeah.
And it's being enforced as rules, not just as a culture. So it's
And in
both
the law.
cultural and a rule.
Yeah. Yeah. I think
Yeah.
it was the CDC. I think you are correct on that citation there. I have talked recently with someone, and for those that don't know, our film, The Detransition Diaries, is coming out as a book. Yay. We are in the editing process now, and I talk about this in the book, about the role of ACEs and advanced childhood, or not advanced, goodness, I can't even talk, adverse childhood events. And you talked a little bit about trauma. When you see the numbers, 3 out of 10, all the girls in the program declaring that they're non-binary, of course, everyone in that cohort obviously had some sort of mental instability or something that put them in the hospital, and they're working backwards. But what do you think the occurrence is then of kids who have these ACEs or traumatic events, who are now identifying or saying that they were born in the wrong body? What is there a connection there?
Oh, definitely. I mean, I think it's changing in terms of the degree, because now it's becoming so trendy, and it's being pushed so hard from every angle, right? From the schools and Hollywood and TV, on social media. We know the internet is a huge influence, and the social contagion is so strong. The social influence is so strong.
Mhm.
So I think there are some people that are getting sort of sucked into this that don't have serious trauma or don't have serious mental health issues. But I think they're probably easier to get pulled out of it because they don't have other things that really made them feel so strongly that this was a new identity that would help them.
Mhm.
But the wave of detransitioners that we're seeing now, especially those 3 women that you did that film on, the time period that they got into it, I think every single, from what I understand, every single person I've talked to in person, on the internet, or just seen videos and interviews on, every single person has had some underlying mental health issue. Usually it is trauma. Sometimes it's more around autism, or there's, yeah, I mean, there's or really like a really strong grief reaction
Mm.
sometimes. There's so many different situations. Like there's no one. I think we see patterns, but there really is no one size fits all. I think a lot of people have different situations that will end up make them believe that this is going to help them. I mean, what I say the general trend is that someone's having some kind of suffering, whatever that is, and they see the trans identity as a way out of the suffering that they're having, and they're given a lot of false promises, so it makes sense that they would gravitate towards that.
Yeah. Which is all the more reason why a comprehensive evaluation and approach would be would be helpful, right? Like,
Yeah.
sounds like if there's so much going on and we're not sure exactly how to pinpoint it, and it's no one size fits all, then we more than ever need to really be slow and methodical and evaluate what's going on in this child's life or teenager's life or young adult's life.
Yeah, it's really strange to me. I'll just tell you, as a therapist, this 180, because honestly, therapists used to be really annoying about how much they'd analyze things, right? They wouldn't jump to conclusions. Our whole profession is based on analyzing Like what's really going on, right? The unconscious. I mean, we're supposed to not look at things for face value. We're always supposed to look at what's happening underneath the surface.
Mm,
And for them to just ignore that entire philosophy completely is mind-boggling to me.
yeah.
Sometimes I used to think, come on, the person's just hungry, give them a snack, and then they won't be so cranky. Let's stop with the therapy. Like sometimes it was that simple. But
Sometimes it's just a
now,
physical need. Yeah.
but now with this gender issue, we're ignoring everything.
Yeah.
It's just usually so obvious there's something going on. The person doesn't feel like they fit in, they don't feel comfortable in their body, they're having, eating disorder issues. I mean,
Mhm,
if they have some kind of self-harm, I mean, right there, that's something to explore. Why are they self-harming themselves?
mhm.
I just don't understand how we could jump to this conclusion. I mean, as you know, and it's mentioned even in your film, I mean, 30-minute consultation, you can get hormones. That's
Mm,
bizarre
mm.
that's okay. That I think that should be illegal.
Right. Well, we're just
And what are
jumping
the
to medical treatment. I mean, in any other aspect, we want to say, okay, for example, you have high blood pressure. It's oftentimes okay. Well, let's fix the high blood pressure. Let's exercise more. Let's eat better diet. Then let's talk about medication. Or if you're on medication, how can we get you off of this? How can we unmedicalize you? Whereas this is something completely different, where we're medicalizing as fast as we can.
Yeah, it's wild. And as you're talking, I was just thinking about my personal experience. So, as you said earlier, I was on disability for several years, and part of what kept me on disability for so long is because doctors didn't believe me. They were somaticizing my physical issues. They just kept saying I was anxious and I was avoiding life. I was in severe nerve pain, but because what was happening to me wasn't showing up on the typical tests, they didn't believe me and they put me on antidepressants instantly,
Mm,
and they didn't help me obviously because it wasn't about depression, it was about a physical issue. And so here I was being told I was having all these psychological issues and I need to just handle my psychological issues. But I really had a very serious physical issue. It was a rare disorder called thoracic outlet syndrome, where my nerves were being crushed over here. Um, and yeah, and it was terrible.
right.
But all the doctors, they all thought they were professional therapists and were giving me therapy. I mean, I even had doctors literally giving me cognitive behavioral therapy in their offices. Meanwhile, they weren't addressing the fact
Right.
that I
Which
actually
is
have a
normal.
medical
Yeah.
issue.
Yeah. It's a great example. So we've talked a lot about how we are responding, but how, in your opinion, should therapists or mental health professionals be responding to this? And what would you like to see?
Well, I think the obvious is I think we need to treat people as whole human
Hmm.
beings.
Hmm.
Typically, as a therapist, like I said earlier, we do a full assessment. And what that involves is finding out all the different aspects of what's happening with that person. You talk to their families, oftentimes if we're talking with kids, we even can talk to their teachers, we can talk to people in their lives. We're like detectives where we find out what's going on so we can explore and find out what's happening. And now with the gender issue, none of that is happening. There's no exploration. There's just instant affirming.
Hmm.
So I think that we need to explore. Um, I do think probably some people might disagree with this who are really, I guess, pure about this. It is difficult to just instantly say to a person who's identifying as trans, no, you're not, you need the truth. This is what you are, right? And
Hmm.
I think sometimes that can just push them further away from you, and then
Sure.
there's backlash. So I don't think it's helpful to just throw the truth at the person right away, but to work with them to help them get ready to hear the truth and
Hmm.
to learn about where they're coming from and why they're believing this.
Hmm.
So
Or discover the
confronting
truth themselves. I think, I've done
that, yeah,
before, but
exactly.
kind of.
Like that girl I described earlier, I feel like she was primed to get there. If I were her individual therapist, that's what I would have been doing.
Hmm.
Exploring with her. Why, what are the good parts about her parents? Why would they not want to believe her? Explore with her what happened to her. What, when did she decide she was non-binary, and what did she get out of it? And what would happen if she wasn't? Just all these different things, and just
Hmm.
explore her individual issues. What with her relationship with her body, which is probably really not good, difficult. Just all
Hmm.
the things that a therapist does explore.
Hmm.
So that's what I would be doing. Yeah.
Yeah. So talk to me then about, it's a great segue, about the program that you're building. Why is it needed, your program? And what is your vision?
So yeah, because I can't work full time, I can't do full time therapy anymore because I still do have chronic pain.
Mhm.
And I was taken out of my job, unfortunately, because of the California mandates, and I made a personal decision. I decided that was my time first to speak up and be the voice for a lot of other people that agree with me but can't because of this cancel culture. And then yeah, I built this program called the Parent's Guide to Mental Health because I saw the mental health system be so radically different from all the years I worked as a supervisor. All this training I had, I felt like was being erased. And I wanted to basically put out my knowledge that I have to the universe, and mainly for parents, but it doesn't necessarily have to be for parents, on what is appropriate mental health care.
Hmm.
And I actually built some online classes. I built 10 online classes, actually 11. I just added a new one.
Awesome.
11 online classes on all different topics. And gender dysphoria is one of them. It's obviously the big hot topic, but the way I see it is actually a symptom of a bigger problem. I just see how the mental health system is being kind of corrupted,
Mhm.
and that's just sort of the symptom of it, where we're not seeing therapists do thorough assessments anymore. We're not seeing therapists involve families anymore. We're seeing therapists display a lot of red flags, not having appropriate boundaries with their clients, where they're using their clients for their own egos, that sort of thing. Disclosing too much. I'm there's always discussion about what's appropriate self-disclosure, but when you're disclosing so much that it's no longer about your patient, that's inappropriate.
Mm.
So just I've put out a lot of information, a lot about what my training is and my experience, so that the parents are emboldened to know what's okay. Because I think when you're in crisis and your family is struggling, you feel uneasy, like something's not right, but you don't know what it is and you don't know what to confront. And so I wanted to put out there that information, like give the language, what just therapy words, so they can say to this therapist, this isn't kosher, I don't feel this is right, and this is why.
Mm.
And you read what I write, and you read like what questions you can ask your therapist about what they're doing with your child, or even how to screen for an appropriate therapist, so that you can actually have the language
Mm.
and be the best advocate for your child and your family and for yourself.
That sounds like such a great resource because, like you said, if something comes up, maybe it's the first time these parents or families are having to need a therapist or need help, and you don't know what to expect. I mean, we just had a baby and we're using a pediatrician now, and even that, it's like, okay, I'm in the medical community. I'm a nurse, and how even intimidating it can be, like just to find a pediatrician and what kind of questions you should ask. And so I imagine that parents who have a child who's struggling and they see their child hurting, they need to know that they're seeing a competent health professional. And I think that sounds like a great kind of guide to answer some initial questions and help them really. I'm thinking of Bryn too in our film Transmission, What's Thrush to Reassign Gender, and how she had to really advocate for her daughter to find a pediatrician that wouldn't just affirm her, and the I'm thinking of professionals who say, would you rather have a live son or a dead daughter, and how that's like really malpractice, right? Like that's
Yeah,
not okay.
I have a whole section on that actually.
Yeah.
So
And
I
parents
have,
don't know that
yeah.
that's not okay.
Hmm.
So yeah, anyway, I'll let you continue. Sorry.
Yeah, so sorry I interrupted. So yeah, I have a whole section on that, and some of it I actually put on my social media, on my Instagram, which is the Truthful Therapist. But I go into more detail in my lessons about things you can ask the therapist about if they start to basically tell that lie, because it's a lie. And the first thing to do, I think when you're in that moment, you're blackmailed, you're like, ugh,
Yeah.
and if you don't know, you think, yeah, and an expert's telling you this, you think, oh my gosh, this is what I have to do. I just listened to interview with Chloe Cole, who's been very outspoken, and she said that's exactly what happened to her parents, and that's how they were persuaded to go along with this gender medicine. But yeah, the very first question I put out there for the parents to ask is, why don't you ask them about what studies they're referencing, how and see what they tell you. See what they actually present to you, because what happens is they're just parroting these things, but they've never actually looked at the studies themselves. I mean, I've seen those trainings. They don't even give you they don't even give you the studies. They just say it. I mean, they just say these things empty, and then then people just take it at face value. So be
Mhm.
like, okay, can I see the studies? There are these fake studies out there, but they've all been redacted, and none of them prove anything because they have very small sample sizes, and they don't actually follow a population long enough because we don't have the long-term data. The only long-term the only long-term study is that one from Sweden from like 2000 that ended in
The Disney study.
2003.
Yeah, the
Which
Disney study, is that the one you're thinking about?
I'm not
Disney.
sure what it's called. It's like from 1973 to 2003
Mhm.
where they
The
study,
one
and
that
it's
showed,
adults
yeah, suicide risk was actually higher after.
higher in the
Yeah,
end
that was
after
Disney
gender
policy.
assignment surgery. Yeah, that's the only one that really shows anything, but it's actually that one's sort of outdated, and it doesn't really reflect today's climate, especially
Mhm.
with youth.
Right.
So we don't have really don't have the data at all. So that's just one thing to push back on. Well, show me the data. I actually talked to a parent and I had her do that at a gender clinic. And first she said they just didn't respond. It took them several weeks to respond. And then when they did finally respond, they showed her this study that just showed these questions that didn't prove anything. The questions actually just asked the child if they've ever felt suicidal, which
Oh,
is very common for someone who's seeking mental health treatment to have ever felt suicidal, not that they are suicidal. And then it doesn't prove anything about whether if they're affirmed or not, if that changes the outcome.
mhm.
So that's the other thing. So yes, we have a population who tends to be more suicidal because, as we were just saying earlier, there usually are other mental health issues. The three women in detransition diaries, I think they all I don't know if they felt suicidal or not, but they all had mental health issues that
Right.
were going unaddressed. And so that makes them more vulnerable to suicidality. So I think that's why it's easy to weaponize this. But you got to use a little bit of critical thinking and realize that, well, is it the gender or talking or affirming the gender that's going to alleviate this suicidality? Or is it addressing the mental health issue or maybe the family issue or the eating disorder issue or whatever the issue, the trauma, addressing that, is that going to alleviate the suicide? And it doesn't happen quickly. Nothing does.
Yes.
So
Yeah. Well, and I can imagine in that situation too, parents do want, they want to relieve their kids suffering. What parent wants to see their kids suffering and struggling? Um, and with the polarization of the media and this on this topic, it can be so overwhelming. So appreciate your willingness to be a little bit of a renegade and really help parents with that program. Is that something that you will continue to add classes to and continue to
yes.
build? What's your long-term vision for this?
So yeah, it's ongoing. So it's $5 a month right now. And I just added a new class. Basically, it's about how and why parents should be involved in therapy specifically so that you can confront the clinician about why they're not talking to you about your kid.
Yeah.
So you have specific things like, for example, like you need to talk to a parent to know what was the developmental history of your child. A child doesn't know all. They don't know what they were doing when they were a toddler, when they started walking and talking. Those are things that are very important for a clinician to know
Mhm.
when they're working with somebody. So that's just one example. So yeah, so I'll be adding content. I have lots of ideas. They're all in the works. I've also been doing a Substack to supplement it, which is Pam the Truthful Therapist. And yeah, my goal is to basically get that information out to parents. I am going to be offering consultations. So if a parent is either looking for a therapist, or really my vision was if you're working with a therapist and you weren't sure about what they were doing,
Mm,
you could talk to me about what they're doing. And I'm not even talking about like specifically the clinical issues, but just the approaches. And I could say, well, actually, it sounds like they're avoiding this very glaring issue in your family.
sure.
Or I actually did a consultation with a parent and she said, well, we just want our kid to be happy. We're trying to get her to be happy. And I told her about how, sometimes therapy isn't about being happy. It's actually about facing the pain. And
Mm,
that's how you to work through it. And a therapist should be helping that child be able to cope with their pain so that they can, obviously land being happy or find happiness and feel joy. But just being happy is really not the goal. It's unrealistic. No one can just be happy.
yeah.
So like helping them understand what therapy can do and what it does, just ideas like that. And yeah, just giving them that
That's
insight
great.
on what it is.
Yeah, I think that's an incredible resource. Can you do consultations outside of the state of California? Would this be open to, or are you,
Mhm.
because I don't know if there's limitations as far as like licensing and stuff, but would
Yeah,
that,
I don't need my license. That's what's so great about the fact that I'm stepping up is with what I'm doing. I have a license. I clearly have a lot of experience.
yes.
I I'm caught up on my CEUs, which really are lame here in California anyway, but I've done all the legwork for it. I have the credentials, but if something terrible would happen and someone were to threaten me to take away my license, it's really not a big threat because I'm not doing the actual direct clinical work. What I'm
Sure.
doing is I'm helping them find someone who will do the clinical work. Like my goal is not actually to do therapy with your family. My goal is to help you find a therapist that will do appropriate therapy with your family. So
Wow.
yeah, it can be anywhere. I mean, even internationally, quite frankly.
Yeah, that sounds great. And your resource for $5 a month, that's so minimal considering what's at stake here. And I think like you've talked about, you have so much. I can't speak to Pamela enough as far as I love that I get to know her and get to see her at events. And for anyone listening, she has a great deal of experience. Like you said, you've studied at Berkeley, you've been in New York. So I do think her program is worth it. And she is an asset to this conversation. So I appreciate that. We'll kind of wrap up with a couple of more questions, but I like to ask everyone I have on the show regarding this issue, do you have hope for the future? Do you see tides changing? What do you think?
Yeah, for sure. So I know that a lot of people have been in this fight for a long time.
Mhm.
I've only really been public. When did I start? It'll be almost a year where I've been public on this issue. And so much has changed since then. I mean, both it's gotten more radical, I'd say, on the left, but at the same time, so many more people are aware of this issue and so many more people are interested in hearing about it. Um, it's completely changed that so many more media outlets, I mean, not the real mainstream ones, but a lot of media outlets are talking about it. The detransitioners, they have really found a voice. They have found a community that was not the case, even I think even just a year ago, but definitely 2 years ago. So the fact that so many people are talking about it and so many people are interested in it. I mean, before, if I had said to someone, this was happening, they would think I was crazy. Now people are they come up to me and they start telling me about it. I'm like, yeah, I know.
We've
But
been
that's
living
great.
this.
Like I know I've been talking about it for a while. But the thing is that it's great, because they just hear about it. But you know what? That's great because the word is getting out. It's
Mhm.
becoming a more mainstream where people are recognizing this is a problem. And it's a problem. This isn't, I mean, they've made it a political issue, but it people across the political spectrum see this as a problem,
Mhm.
caring about kids. I'd say just having common sense about what we were just saying earlier. I don't think you need a therapy degree to recognize that you need to explore issues before you start doing drastic medical interventions on someone that isn't required. So I think people are seeing the common sense and they're talking about it. People are
Mhm.
talking about it among themselves. I think the tide is turning. I think it's going to take a while because the people who are invested in this, the higher ups, they're invested in it. So they're pushing harder. So
Yeah.
there's more conflict. It feels, in a way, it feels worse because there's more conflict. There's more of a clash, but that's because more of us are speaking out, right? And there's the
Mhm.
more films like yours coming out. It's just a lot more talk. So I think it will turn around.
Yeah.
Unfortunately, I believe there's going to be some more collateral damage in the process, but I don't know what the timeline is, but I could see in 5 years things being very different than they are right now.
I hope so. I hope so. For these kids' sake, it breaks my heart to hear. And like you said, and I can't reiterate this enough, like because of the work I do and the work you do, we see this. And when we tell people, they're kind of like, that's not happening. No way, and then they hear the stories. And unfortunately, it has to happen personally or within their sphere. And we just really want to keep kids safe, like bottom line, right?
Yeah. It's
Um,
hitting more families. I think that's the other
yeah,
reason.
yeah.
People who just think, well, that's happening to those people. And then
Mhm.
their daughter who's always been girly their whole life, or maybe their daughter who's just been a little shy, but this hasn't been an issue, suddenly won't talk to them because of this. They're like, oh, wait a second. maybe it's not about being transphobic after all. Maybe there's more to this. So
Mhm.
people are seeing it firsthand.
Yeah. So my last question then is, what can parents do? Let's say we have some parents listening, and what's like their first step? Their kid is telling them they're born in the wrong body, or they're changing their pronouns, they're declaring themselves non-binary. What is a parent's should be first step?
Well, if possible, take away their social media and their phones.
Okay. Get outside. No.
Yeah, I know that's not easy, but usually that really fixes things very quickly. A lot of it comes from that. Um, Also, it depends on how deep they're in it already. There's kids that have been quietly deepening themselves in it for a really long time, and it's
Mhm.
going to be harder to have a conversation with them because they feel really, embedded in it and really identify with it, and they feel like they found their new family and all that. And that's what makes it so hard. It's the division of families to me that's one of the saddest pieces of all this. And that's what makes it so challenging. But yeah, it if you can, that you talk to your child about what's going on. Just ask them basic open-ended questions. But I would try to do it in a way that's not confrontational and not saying there are only two genders and start yelling that at them, or start saying you're a girl, like stop it already. And because that, unfortunately, I think that will push them further away from you if they're getting into it.
Sure.
But yeah, if you the best you can, figure out what are the influences on your child, whether it be the friend group or the school, and try your best to remove them from it and find a good therapist, one that's not gonna just affirm. And really, it's probably about your family. Like, I'm not about blaming people, but it's that's not the point. It's about just figuring out what's happening in your family, figuring out what is your child missing. Maybe they need more attention. Maybe everyone's been distracted. Maybe they've had a hard time during the lockdowns, and this is one way they're manifesting it. Maybe they don't feel comfortable with their friends, and they found a new friends and they feel good about themselves for the first time. So it's really about figuring out what's going on with your child and
Mhm.
being present with your child. And, you probably might need a therapist to figure that out.
Yeah. And it's not bad, right? Like therapy is great, and relationships are messy, and life is messy, and it's complicated. And sometimes you just need an external perspective to help you kind of get through the weeds. So I'm a big advocate for therapy if it's needed, or just in general. So anyway, Pamela, I want to thank you so much for agreeing to come on the show. And I look forward to seeing you at events around the Bay Area in the future. But thank you for caring so much about families and the families that you will serve. I really appreciate it.
You're welcome. I wanted to add one more thing about advice.
Absolutely.
So there are a lot of parents and families that are going through this. And I really advise seeking those out, other parents who have been through
Mm,
it, because I think they're actually, maybe in a way, the best advisors they have learned tricks to the trade to how to get through to the children. That
yeah.
I think that's where I've actually learned the most from, is other parents who have been in it, have pulled their children out of it, or still even in the thick of it. So finding other parents. There is a website called Parents of ROGD Kids and .com, and that's one really good resource. There's also a Substack called Pit Parents, I believe, Parents of Inconvenienced Truths About Trans. And so they have really good resource. And then of course my course might be really helpful. I
Yes, of
have one
course.
specifically on gender dysphoria. So yeah, seeking out information.
Yeah, I think that's great advice, is to kind of finding, just like you said, the folks who are having to detransition and go through this, they've kind of found support within their group. And so parents finding support with other parents who've walked this and have been doing it. I know a few personally that they're involved in those groups that Pamela just talked about. So yeah, I think finding like-minded individuals, or just others who have experienced, and it's okay.
Yeah.
So anyway, yes, that's great. Thank you again. Thank you so much for coming. Thank you for serving families. I can't say thank you enough, Pamela.
You're welcome. Thank you for having me. Thanks for allowing me to have a voice.
Yes. And I want to thank all of our listeners for tuning in. I hope that you walk away from today's conversation empowered, emboldened, enlightened, encouraged. And even though our conversation with Pam is over, you can find and follow her on Instagram at The Truthful Therapist, on Twitter at Red Pilled LCSW. I hope did I get that right?
Yeah, those are my credentials. So I'm a licensed clinical social worker. So
Yes.
LCSW. Yeah.
Red Pilled, PILLEDLCSW. And you can find her on Substack at thetruthfultherapist.substack.com, and on her website, where you can also find her program at www.thetruthfultherapist.org. And I will include all of those links in our little description so you can find them and you don't have to quickly write them down. But again, thank you for listening, and may you always think critically and think beyond the masses.